It's fascinating that you said that, because I think people forget what they were thinking at the beginning of the pandemic. It was blatantly obvious who was the primary risk, so much so that they were talking about trying to protect Granny. I mean,
Mhm.
so there was a very clear understanding as to where the risk was. Somewhere along the line, something started to change. And where do you think that was?
Oh, that's a difficult one because to me, when I looked at the data, I mean, there was some uncertainty, but it was pretty clear, like you mentioned, where the risk was. And as time went on, it became even more and more clear that we didn't have to, like the majority of the population wasn't at high risk. That just became more obvious. Uh, right away, the government acted in a very panic mode type of way. And when new information came about, they didn't course correct. They just kept going down the same wrong path. So they are actually consistent in what they did. They kept going the same way, and that was to instill panic and fear amongst the population. And when information came out showing that it wasn't as deadly as they said, instead of trying to use that and reassure the public, instead they came up with new ways to promote fear. So I'm not sure if they really changed or just got worse as time went on.
That's very interesting. I mean, it raises some. I mean, now when you look back, because I think because I was looking at it similar to yourself in terms of understanding what was going on and trying to understand why did certain decisions occur which didn't seem to make any sense. Well, is it that they just don't understand? What is happening? And so I can see that pattern that was evolving. And so at that time, it was, okay, they're doing the lockdown and so on. When we start to shift into the end of 2020, and we're going into 2021 now, and we're starting to see the vaccines come through, what were you thinking from a risk benefit kind of analysis from the statistics?
When I was looking at this initially, I could see massive statistical manipulations. So I was concerned about that. And a lot of these manipulations were coming from our public health agencies. So I was very keen on following what was going on. And I guess into the fall of 2020, where there was more and more talk about the new mRNA vaccines. And so I started reading studies about mRNA technology and past experimentation and where that was. And that concerned me greatly because it seemed very clear to me at the time that that technology was not ready. And yet they were talking about bringing in vaccination by December. Um, and it was also clear that they can't possibly have any, mid or long term data showing the risks or the ramifications. So that was an issue to me. So as we journeyed to, December 2020, I had already been talking to my family and my siblings about the new technology coming out, and that even if the case was that these vaccines were safe and effective, which they had no way of really knowing they would be safe since they didn't have the data. But even if they were, most of the population didn't need them. Like we were not at risk. The children were not at risk. The, people my age who are healthy were not at risk. So I did not see any reason for us to take this vaccine one at all. And certainly without knowing the long-term safety, it just didn't make sense. So that's where I was when the vaccines started. Right away, when the clinical trial reports became available, I did read them. And at that point, I became more concerned. There was a lot of red flags in the clinical trial reports. Um, and at that time, I was already, like I said, I'm very open in my family. I was already talking to my children. I was already talking to my siblings about what that meant.
You mentioned about the original trial, and I too remember looking at the data there. And I subsequently did a reanalysis of it, and I went back to the data because by that time we had the full study, and I got into trouble on social media for highlighting that the cutoff date was November the 14th in terms of mortality around it. And I then just calculated that if they had shifted that cutoff date to December the 19th, the mortality would have been completely different. Just 1 month. I got into trouble for saying that. But I understand what you mean in terms of there were concerns straight away that something is not quite right. But this was then pushed forward onto the population.
Yeah.
And I mean, I could acknowledge the high risk because they didn't know, they were concerned about them. I had thought that they shouldn't do anything with people who are already infected. If somebody hadn't been exposed, okay, reasonable to take a risk. Would that have been a reasonable risk benefit analysis at that time?
Well, I would start with the children. When I look at children, there was never any real benefit for any kind of vaccination for the children for COVID-19. They simply were not at risk, serious risk at all. So I never found there was any reason for children to be taking it. For adults, again, for much of the population, if you're not at serious risk, why would you take an experimental drug? When you look at the elderly, there you may have a case. At the elderly, you look and say, okay, what is your risk from this new virus? And what is the safety profile of these drugs, and is it worth that risk? When it comes to new experimental drugs, that should be up to the individual, whether they're willing to take the risk, and it's up to our agency to properly express what that risk benefit looks like. And they didn't. They did not convey the risks, and they forced it on the population. So that was a huge concern. And they started off with focusing on the elderly and our healthcare professionals. And I was really concerned about that because, I had 2 siblings in healthcare. So, I felt that they should not be forced to take this experimental vaccine.
Yeah, well, so it raises the question then, because you were in Ottawa in Canada, and
Yes.
that happened to be the center of a global vaccine mandate challenge with regards to the truckers. Did you go down to the protests?
I did go down to the protest because I live in Ottawa. I was able to get there pretty fast, and I went down 13 times. I wish I could have went more, and I did try to go more, but then the Emergencies Act came in, and we couldn't get down there. It was a fantastic celebration. A lot of people had been isolated, and at the time, the unvaccinated were being treated horrifically, and myself and my family, we were going through a really harsh time. It was I can't even express the state we are in when the truckers came, and it did give me a lot of hope, and I'm grateful for it. But up to that part, my family had gone through a lot of harsh treatment. We had my 2 older kids were in university, and they did not take the vaccine, so they were not allowed to attend university. They were kicked out of their varsity sports. My husband, he works for the federal government, so the federal vaccine mandates impacted him. I have actually almost all my siblings were impacted with the vaccine mandates one way or the other, either through working for the federal government or for healthcare. So we were going through a really rough time.
And so that difficulty inspired you to do something very few people would do, which is that, what you said, I'm going to take on the politics. What happened in your head at that point?
I became increasingly concerned about where things were going in Canada. In the spring, they started talking about, it's so ridiculous. In the media would start off by saying, they would never mandate these vaccines, would they? And then there was talk about it being unconstitutional, which it was considered unconstitutional before the fall of 2021. And as soon as they start talking like that in the media, right away, I'm like, oh my God, they plan on making these mandated. So then I started looking into the Constitution and what was going on then, and I became more and more worried. And it looked like a lot of the politicians were on board with vaccination. There wasn't a lot of opposition. They started talking a little bit about requiring certain people to take vaccines. And I remember on Canada Day, I went to Parliament, and a leader of the People's Party of Canada was speaking. And the People's Party of Canada is basically a libertarian party. They were against vaccine mandates. They were against the lockdowns. They were for accountability and responsibility. But they were talking at that time, and I thought, well, they are the one party who was opposing a lot of the nonsense that was going on. And shortly after seeing them there, I heard word from the universities that my kids would be required to take the vaccines in order to go to school and in order to play sports. And then shortly after that, in August of 2021, Trudeau ran for re-election, and he made vaccine mandates a wedge issue. So he campaigned on bringing in vaccine mandates for federal workers, travel restrictions against the unvaccinated. He paid provinces to bring in the vaccine passports. And so almost in a fit of desperation, I jumped into the politics to oppose those measures. And I ran for downtown Ottawa, which is Liberal NDP territory. So in downtown Ottawa, there's a lot of support for Trudeau. So my message was not welcomed, but I knew that, but I ran anyway, because I felt this was a huge, I just couldn't believe Canada was going down that road. I thought it would be a permanent stain on Canada, and it's something we should never do, is to mandate these experimental injections and to ostracize a huge portion of the population. So I ran into politics.
Wow. I mean, that's incredible. I mean, I think that's an inspiration to people in the sense that if you don't like what you're seeing, become the change. I mean, that's tremendous. Now, sadly, you didn't win.
There was no chance of me winning. Like, realistically, there was zero chance that I could get a seat. But it was downtown Ottawa, and a lot of people look at the politics in downtown Ottawa. So I knew it was important for somebody to speak out in that riding, and to have a voice. So I was hoping that I would bring awareness of the issues, and that maybe they would win seats elsewhere in Canada. So it wouldn't be me who'd win a seat, but I was hoping for some kind of representation in Ottawa to fight vaccine mandates, and not just the mandates, but the lockdowns